everyone. My name is Octavio Pontes. I am a neurologist and professor of neurology at Ribeirão Preto Medical School, University of São Paulo, and also the editor-in-chief of the World Stroke Academy. And today is my great honor and privilege to be here with Professor Robert Mikulik. He's professor of neurology at Masaryk University in Brno, Czech Republic, and also the founder and director and PI of the Rescue Plus Registry initiative. And Robert, it's a great pleasure to have you with us today.
Thank you very much, Octavio. Hello, everybody.
Hey. Okay, Robert, first of all, I would like to have an idea. Can you explain to us what was the motivation behind, the Rescue Plus project and how that came to your mind and was developed?
Yeah. So Rescue Plus project it's a grant actually, which is funded by the European Commission, and basically the idea is to enhance the functionalities or maybe improve the functionalities of the rescue registry. So the rescue is the platform which collects data on the management on stroke and then benchmark the hospitals and provide hospitals with the information how they manage stroke patients, so physicians can see the gaps in stroke management and gives them the motivation what needs to be improved, and also if you are improving something that you can actually document the improvement based on the data. So it's a kind of like a gap analysis tool and quality improvement tool. But there are a lot of limitations with this process. The biggest limitation, and that's the general limitation of any data collection, is that it takes a lot of manpower to collect data. So I think that if we can figure out how this data can be somehow automatically ingested into registries in general, then actually it would lead to a lot of improvements in medicine. So we are developing this tool. It is using the artificial intelligence, specifically natural language processing. So together with the partners across the Europe, specifically, for example, here with the Charles University in Prague and with a company Ontotext in Bulgaria, we develop a like an annotation tool. So right now we are annotating the discharge summaries to train the system to recognize the individual items that are collected, in rescue, like age, sex, IVT, and door to needle time, and so on. So the idea is that we take some document like a discharge summary, and this data will be automatically transferred to rescue. Now we'll see how this works. But if this works, that would actually open a lot of opportunities for quality improvement, because there will be more hospitals that can provide a quality monitoring to patients. We will get more data. It's obviously will have a lot of implications for the research.
Okay.
Now,
okay.
The other idea was that having the system that gives you this information about the quality, there are a lot of who knows the rescue, there are a lot of information, a lot of dashboards. So it takes a little bit effort and experience, right, to be able to interpret what you see. So we want to have something which is simpler, something like a ChatGPT. So basically, you ask the question, you get the answer.
Right.
So we hope that we will have kind of like a virtual assistant inside the system, and you will ask the question, like, for example, what is the biggest problem in my hospital? And then the system will be able to identify what is the major issue in terms of the quality management, in terms of the stroke management, and we'll tell you, for example, you are the worst center in Czech Republic or in Brazil in terms of how many patients are admitted to stroke unit, for example, right? So that's the idea. And that would open the platform to be used more broadly, because right now I think it's used by only those that are very, very enthusiastic and who are willing to spend time understanding, all these figures and dashboards and so on. So that's the other idea. And the third thing is that what we are missing is the way how we obtain the information directly from patients. So of course, the patients are, big stakeholder, and and we need to figure out how to get the information. And it could be different type of information. I think that one of the major limitations of the registries in general is the fact that it's difficult to obtain the outcome data. So if we have the outcome data at the end, then we can understand how the whatever is happening in the hospital is impacting the outcome.
Yes.
So really the first line problem we want to solve is how to obtain the outcome data. And so we are building some application and like a virtual assistant for a patient. Hopefully it will be conversational. Right now it's not a conversational, it's only like you are typing, but we will move to the conversational assistant. And hopefully this assistant will be able to take some information from a patient.
To improve adherence, right? And collecting data afterwards, right?
Yeah, exactly. So, yeah, I mean, of course, I mean, it's simple things like ranking. If we have the ranking, then it will really help a lot in terms of understanding, which processes in the hospital, for example, are driving ranking scales, right? But then we don't have to be limited with ranking. I mean, patients after they are discharged, they have a lot of time, which is not the situation when you see them 3 months later in your outpatient office. Nobody has a time. I mean, we as a physicians don't have a time, but when a patient is discharged, there is plenty of time to ask a lot of questions. So we tested very, very simple application. And during these 3 months, we, in some cases, were able to obtain answers to hundreds of questions, like, all these depression scores and the quality of life and so on and so on. So we know that not all the patients, but some patients are willing to provide a lot of information. Why not? Every Monday you get there is the system. They will send you some questions. So during these 3 months after discharge, you can learn a lot of information. And yeah, you can ask the questions that we don't have time to ask. We know that patients suffer from many conditions, right, after stroke. And in most healthcare system, there is not a capacity, really to explore all these conditions in detail. So we hope actually that we improve the diagnosis actually of these conditions with this system. And then
Robert.
Yeah.
Go ahead. No, go ahead.
Yeah, the major issue is how to make this, how to keep patients motivated. So we are also trying to figure out the motivation of patients. We have different ideas. So for example, one idea is that kind of like a typical question which you ask as a patient is, how do I do? Is it normal that, is my condition still within the limits or is it outside the limits? And, imagine yourself after like a surgery or whatever, something happens to you, you have a trauma, you have a pain somewhere, right? So then, is it normal that your pain lasts for a week or 2 weeks, or is it okay if it lasts for a month? So kind of like a similar thing. So we can actually benchmark patients against each other. There's the same analogy what we do with rescue, in rescue, how we benchmark the hospital. So maybe we can benchmark the conditions of patients. And then basically we'll answer the question for them, if whatever is happening to them is normal or it's not normal. So I think that could be kind of motivation for a patient. The other functionalities we would like to develop is to train the assistant on guidelines. So basically the assistant hopefully will be able to answer some elementary questions like what is the stroke and what are risk factors and how is this treated. And potentially in the future, because we in rescue, there are information on individual patient, so we can kind of individualize these answers. But that's kind of like transiting the whole platform to the decision support system, and it's a little bit different legal environment, very strict in Europe. So we would have to certify the whole platform as a device, basically. So that's basically the idea behind the Rescue Plus projects. There is a lot of actually legal work. 1/3 of all the funding from European Commission is go to lawyers, which is a lot of background work. Nobody can see it as a user, but it needs to be done to be safe and legally compliant.
Yes, Robert, I believe that education and training are critical for the sustainable quality improvement and also collection of data and analyze. I was wondering how the Rescue Plus incorporates these educational elements and how could, for instance, the World Stroke Academy or in an education platform help to move forward this collection of data.
Well, I think we should educate physicians about what quality
Quality
improvement,
improvements.
what is the quality improvement. It's not a medical expertise, it's more like a managerial
Exactly.
expertise, right? And
Yeah,
we are not trained as a physicians
we
to
are
be
not.
managers. Oh, I mean, we think that we are a good managers, but frequently we are not. Then we complain that the things are happening, and we think that this is, something somewhere,
Yes,
outside our control. But frequently it's actually in our hands, and we can change it. We just don't know how because we were never trained how to change it. And so I think that it would be actually kind of useful to train, young physicians in those skills.
right. I see. And I was also wondering, I mean, Rescue is Plus is active in multiple countries. How do you would tailor the program to different healthcare systems, countries, and cultural contexts? I assume that's been very challenging, right?
So yeah, that's a good question. So a lot of these developments is actually language specific.
Right.
So we need to start with some languages, like for example, this conversational tool. It's
Okay.
also I mean, imagine that you have a virtual assistant which talks to you.
The language.
So
Okay.
it's a language specific. So or this automated data import tool. Also, you need to train the AI uh, using certain language. Now, if you trained it on one language, potentially it will be easier on the other on the second language, and so on. So, but it's language specific. So we are starting with a few languages. We will see how it works. And yeah, the idea would be then to train it on more and more languages.
Okay. Okay. So the grant is gonna have an end at some point, and my question is what are the next steps in future directions for the Rescue Plus initiative? Are there plannings for expansion or integration around the world? What's the learning point and how can we move forward from there?
There are a lot of plans. Right now, we are actually writing another EU grant, which is for using the artificial intelligence. So we have a big consortium of more than 30 partners. We'll see. It's very competitive. Only 2 projects in Europe will be
Of
funded.
course.
So, but yeah, I mean, we have new tools in rescue. For example, I think that in the last months, we opened this discharge summary tool. So there is actually a button, and if you click on the button and you select the language, I think we have now like 7 languages. It summarized the case. So it says, woman, 72 years old, admitted to this hospital with stroke at this NIH stroke scale, received thrombolysis, and so on, so on. So it's like a descriptive of a case, and uh, you can apply it when you're a patient, and it's always the same. It's not an AI tool. So all these 1 million of patients that are currently being quality monitored by Rescue, if you click on the button, you will get exactly the same case summary. So it's actually harmonization of the
Right.
how we can communicate as the physician. I think that's other thing that maybe we can consider to pay a little bit more attention to, right? Because like not between the countries, I mean, the situation like even within one hospital, physicians have a different way how they communicate the case. That's even more pronounced between 2 hospitals. Like when we take 2 Czech hospitals, then you look at the discharge summary. It's different. It's a different structure, a little bit different information. So that's what we are trying to harmonize. So that's a completely new tool. Now, actually, just this week, we open a really nice dashboards in Rescue. So there is like a heat map, and it's actually for the national coordinators. So the national coordinator can open the heat map, and you see all this all the hospitals in a rows, and then in the columns you has the performance, the KPIs, and if the KPI is good, it's green, and if it's not good, then it's red. So you can look at your country, and in one picture actually you see how the whole country is performing, and you see which hospitals have the problems because they will be red, and you can see which quality indicators you have the problem with in your country, which would be red, the columns. So that's another way how we try to, in one picture, provide as many information as possible. And yeah, it's just open this week. The next heat map, actually, the similar functionality will be for country-to-country comparisons, and that might be interested for stakeholders in healthcare, like ministries of health. So there are a lot of things like we do every month. There is something new. We hope that we try to communicate this with the users, sending the emails. So yeah.
Okay. All right, Robert. Thank you so much for a very thoughtful discussion about the Rescue Plus project. And I hope we're going to see more and more of it. And thanks so much for your work.
Thank you very much. Thank you.
Bye-bye.